Okay, good morning, everyone. I'm John Fitzpatrick from KC Digital Drive. I am the host for these monthly meetings, and very great to see everyone again here today for our March 2022 meeting. In this meeting, we have the honor of hearing about the work of the health foundations that work in the Kansas City area. This has been very important to us as an organization. We've had the opportunity to work with each of the foundations on at least one project to date, and look forward to other opportunities to do so, as well as more and more technology is seen as really one of the social drivers of health, as we found out specifically during the pandemic, of people being very disconnected and having a difficult time doing what should be relatively simple things like registering for a vaccination. And so all the way to doing telehealth, telelearning, and remote working. So with that, I'd like to introduce our presenters for today. We have from the Reach Foundation on the Kansas side, Carla Gibson. And then for the Health Forward Foundation, we have McClain, Bryant, Macklin, and Brad Hart. And then for the Kansas Health Foundation, Sean Brown. And we'll kick things off today with Carla from the Reach Foundation and ask her, or I should say, for all of these folks, we've kind of given them an open-ended invitation to speak to what they want to speak to about their respective foundations. We probably, as Aaron just noted, we probably ought to do introductions. So the presenters know kind of who's around the table with us, and that may be helpful to you. So let's do that first. I've introduced myself, but let me turn to William next, please.
Hi, everyone. William Crumpler. I work as a digital inclusion program coordinator with KC Digital Drive.
Anurag?
Good morning. My name is Anurag Patel. I'm CEO of Abada Health, but also help with the Kansas City Digital Drive Health Innovation Team.
Aaron?
Ethan, Managing Director of KC Digital Drive.
McClain?
Good morning, McClain, Bryant, Macklin with Health Forward Foundation.
McClain, I didn't do you justice in terms of your role there. Do you want to tell us that, please?
Sure. So I'm the Director of Policy and Strategic Initiatives at Health Forward, but am very well acquainted with KC Digital Drive and Aaron Deacon from my previous roles. I was the Policy Director for Mayor James during his administration and worked on digital equity issues during that time, and also wrote the city's digital equity strategic plan.
Great. Thank you very much and welcome. Carla?
Carla Gibson, Vice President of Programs at the Reach Healthcare Foundation.
Thank you and welcome. Todd?
Todd Ink, On and On. We do 3D mapping.
Okay. Scott?
Good morning, Scott Gunnagle with MetaView, mixed reality.
Doug?
Yeah, Doug O'Hulan, XR healthcare consultant, and also KU School of Nursing, a volunteer faculty advisor.
Great. Anna? Anna, are you there with us?
Oh, I am. I'm so sorry. I thought you mispronounced. I
did pronounce your name.
No, that's okay. That's no worries at all. I'm Anna Hagencourt. I'm with Modern Health. I kind of manage and lead our virtual critical care team.
Great, thank you. Brad.
Good morning, everyone. Brad Hart with Health Forward Foundation. I am just moved into a new role with the organization this week. I'm the process innovation strategist for the organization now. So nice to see everyone.
Thank you. Dennis.
Hey, good morning, everyone. Dennis Ridenauer, CEO at BioNexus KC, a nonprofit focused on advancing life science and healthcare innovation. I'll be moving over to a much like a walleye vision lens here in just a second, and we have our Vice President, Daniel Kennedy, will be on there as well. So.
Great. Derek.
Hi, everyone. Derek Shearer. I'm heading up development of a project called Corpusum, which is a free and open source medical graphic.
Cannot hear John.
Yeah, I'm sorry, Derek, we had a little trouble with your audio. Derek, would you mind trying again? We'll come back, I guess, to Derek. Shelley. Shelley, you with us?
Anything, is that any better?
That is great. Go ahead, please. Okay, Gary.
Hey, good morning. Gary Carnes. I'm our telehealth program manager at the University of Kansas Health System.
Great. Jennifer.
Good morning, Jennifer McLaughlin with Unite Us. I'm in community engagement representing the KC Region Coordinated Care Network.
Great. Jim.
Jim Starsov, I'm program manager at the Solutions Lab at KC Digital Drive.
Aaron. Did we lose Aaron?
No, I'm still here.
Okay.
You want me to introduce myself again?
Yes, please.
Aaron Deacon, Managing Director, KC Digital Drive.
Liz.
Good morning. I'm Liz Cook. I'm the telemedicine manager at Children's Mercy.
Matthew.
Good morning. My name is Matthew Piecha. I'm with the Center for Practical Bioethics, where I am the ethics lead on the Ethical AI project.
Great. Molly.
Good morning, everyone. I am Molly Brown, Director of the Heartland Telehealth Resource Center.
Great. Robert.
Hi, I am Robert Stiles. I'm Program Director for KU Telehealth Rocks and the Policy and Outreach Coordinator for the Heartland Telehealth Resource Center.
Welcome, Robert. Ron.
Morning, everybody. Ron Whiting. I am the Executive Director of KC Health Collaborative, Regional Health Improvement Collaborative. We work on health equity and social drivers of health work.
Okay. Teresa.
Good morning. Teresa Gerard, Guardian Group. I'm participating in the ACL Social Care Referrals Technology Innovation Challenge, as well as I serve on the KU Med Center School of Health Professions Board of Advocates and a guest lecturer.
Great. Good to see you, Teresa.
Is my mic working now?
Yes, it is. Go ahead.
Oh, brilliant. Okay. Yeah, Carla, I just wanted to break the ice on tech problem so you don't have to worry about being the first. So my name is Derek Shearer, and I head up a project called Corpusum, which is free and open source software. It's 3D interactive graphics to have immersive experiences with anatomy and physiology. Software tool.
Great. Thanks, Derek. Okay, is there anybody that I missed?
Hi, this is Shelley Cooper from Diversity Telehealth here in Kansas City.
Great. Great to have you on, Shelley. Anyone else? Okay, with that, let us go ahead and kick off with Carla. Carla, we look forward to hearing you share a bit about what's happening at the Reach Foundation.
Are we gonna do questions after all three of us go, or how do you want to do that?
I think due to your time constraints, we'll probably do questions after each presentation.
Okay, very good. Well, good morning, everyone. I am Carla Gibson, Vice President of Programs at the Reach Healthcare Foundation. I have been here about 15 years now and have had the pleasure of working with John and Aaron on some different projects. and wanted to share a little bit with the rest of you today about the Reach Healthcare Foundation and how we support, or how we have supported, technology and digital equity. So a little bit about Reach. We currently sit at $161 million endowment. So that's assets that we have. Currently, it was a good year last year. So that's up a little bit from previous years. We have a 17-member board of directors and a 13-member community advisory board that guides our work. Something a little different than some of the other foundations that you're going to hear from today is that we have 5 appointing authorities. That means these 5 entities actually appoint seats on our board. And so that is the Kansas Attorney General, the Kansas Governor, Johnson County BOCC, Unified Government, in Allen County BOCC. We have a 6-county service area. We are considered, by state. We have 3 on the Kansas side, 3 on the Missouri side. Our service area on the Kansas side is Johnson, Wyan, and Allen, and on the Kansas side is Jackson County, Cass County, and Lafayette. And that's 3 rural counties and 3 urban counties. Since 2005, when we made our first grants, we've done about 2,000 grants totaling $80 million. We put back out into the community about $5 million a year in the form of grants and other type of support initiatives and contracts and so forth. And more than 80% of our investments are allocated in our 3 priority areas. So this is kind of where we invest. It's to strengthen the safety net, close the health equity gap, and bridge the coverage divide. We recently completed a fairly long strategic planning process, kind of long due to being waylaid by COVID, and launched our new strategic plan in January. We operationalize our strategic plan through a community investment framework. And these are the 3 outcome investment areas, but underneath each of these areas are strategies. And that's really where our investments live. And I encourage you all, if you haven't, or if you're interested, go to our website and pull up our community investment framework, and that will give you a really good idea of the ways we invest our funds within each of these areas. So a little bit more about Reach. That's our vision. All people in our communities achieve equitable health outcomes, and our mission is to advance health equity through coverage, care for underserved people in our region. So this is my last slide, and this is, I tried to capture the ways that we invest in or have invested in digital equity or technology. We don't specifically call out technology or digital equity in our community investment framework, but it lives within our strategies. And we've been able to ensure that we are aware and investing in that area that is very much of interest to you two, underneath pretty much any of the strategies that you look at. So in the past, we have invested in research and education. For example, last year, we partnered with United Health Ministries, a rural philanthropy, to look at the consumer experience with telehealth and put out a report. United Health Ministries had already looked at the provider perspective, but we wanted to ensure that the consumer perspective was looked at. And so we supported a research project that looked at the consumer's point of view from telehealth services. And there is a report, I think it's on our website, around that body of work. We have also done some education, and more recently we did partner with the KU Center for Telehealth and Telemedicine and did a webinar in which it was entitled "In Response to COVID and Beyond." So it was a educational piece that really looked at how do you pivot to telehealth services during the pandemic. So that was another kind of way that we invested in it. We also invest in access to technology. That's for providers and for consumers. We have funded lots of technology, lots of cell phones and burner phones and computers and education. And one of the ways that one of the really significant bodies of work that we invest in are connecting consumers to healthcare. And you can't connect consumers to healthcare without considering technology support. And so that is typically always in our grants to when we fund community health workers, when we invest in health navigators, there's some form of technology that is part of that. We have also included expanded access to telehealth in our Kansas and Missouri policy agendas for the past several years. We have, in response to COVID, we unrestricted grants in March and April to support our federally qualified health centers and our community mental health centers as they pivoted to primarily online patient visits. And some of the grantees used funds to purchase mobile phones for high-risk patients to keep them connected to needed healthcare and behavioral health services. So that is another response to COVID that was related to technology that we've invested in. We've also supported KC Digital Drive in the past. I've been a partner on this effort, and I believe we actually started John's position at KC Digital Drive. So lots of support around equity, digital equity and technology. It's not specifically called out, as I know some of my colleagues will talk about in their funding plans, but it is extremely important to us as a foundation. And I did forget to touch on the last bullet, innovation. We are always open to hearing about new projects. I think we were an early funder on home-based behavioral health services using technology in partnership with KU, probably 8 years now ago. And at the time, I don't think folks were ready for it, and now the pandemic has definitely moved everyone in that direction, but that was a great learning experience grant. So we invest in innovation in all aspects. Most of our grant making is solicited, which means that we don't put out a lot of large RFPs for our funds. We are out in the community and involved and are part of the landscape of healthcare. and really look for our partners and projects to advance our mission. And we are always looking for innovative ideas to support technology and digital equity. And we do have a very strong focus on rural health, and in particular, looking at broadband and other ways to get technology in our rural communities using innovation. So I believe that is it for me. I am happy to answer any questions, or I can stay on through the presentation that we're doing, and then we can all answer questions if you want, John. I just can't stay for the whole meeting.
Okay, why don't we then go to our next presentations, and then we'll kind of join up for questions.
Okay.
Though one question I would ask Carla, if you to just address quickly, is give us some impression of the impact that COVID had on your activities. Did you find yourself having to kind of swing into new projects or provide additional support for existing projects? How did it really impact you?
Just like our grantees who do direct service, we had to pivot as well. We had to automate a lot of our processes that we were doing through paper or in person. We found ourselves, remote, so we had to do grant making remotely, and that recalled for us to actually like I said, automate a lot of our things. I think it forced us to become a lot more forgiving. I don't, that might not be the word, but we really looked at what our grantees were struggling with and how they were continuing to serve clients in the wake of all that was going on. And we just unrestricted money left and right to support and do our part in the pandemic. And so it really opens your eyes to how hard our community works, and how they move and change to despite all things serve their clients. And so we really we did things differently. Now we're looking back and we're like, well, that previous grant to them, what did we do? And we're like, we unrestricted it. They have no report, they have nothing. And so it changed the way our grants, even program grants that were restricted, became unrestricted. They didn't have to do the program. We're like, you don't have to do it. Just use that money to support your organization. And so I think that's definitely another way we changed. And then, like I said, we were in strategic planning during that time too, just like some of my other colleagues on here. And we really had to take into account what was going on in the world, in the pandemic, in your strategic planning. So where we might not have identified workforce as an issue pre-pandemic, we are now looking at how we can, it's actually somewhat of a strategy, because you cannot ignore it any longer. It's always been there. There's been workforce issues in different parts of healthcare, but I think the pandemic has shined a light that you just can't ignore that anymore. So I think in consideration of our next 5 years, we've had to really look at the things the pandemic has elevated to the top and address that within our planning of who we were going to be for the next 5 years as well.
That's very important. Yeah, I can definitely see that. Thank you very much for that, Carla. Let's go ahead and hear from the Health Forward Foundation, from McClain and Brad. You're welcome to share however you think is best.
Thank you. And I will share my screen. So, as I mentioned, I'm actually in a new role with Health Forward as of this week as a process innovation strategist for the organization. Previously, I had been what's known as a program officer, but we've actually changed that role's title as well, and really view our program officers now as impact strategists, and really wanted to get the kind of, we don't actually implement programs. The officer title seems too formal, for that. And so we've been going through quite a bit of evolution as an organization. And so I'll share a little bit of that with you. McClain is here also, who's really our kind of internal lead on quite a bit of this work on the policy side, and obviously has a great background in that work in the region. So wanted to first start off with, my slides will advance. There we go. This may seem very familiar. We have the same service area that Carla just spoke about that REACH does. It's a 6-county service region. We are a conversion foundation from the sale of Health Forward or Health Midwest to HCA. The proceeds of that created our foundation a little over 15 years ago. And these are the 6 counties that we service through our funding, based off of where those original facilities were in place, and lots of conversations with the state attorney generals that ultimately led to our creation. I will talk a little bit about our historical funding, just to give you a sense of, we are a little bit larger. We do about 20 million a year in grant making. These are our historical areas where we had mental health funding, healthy communities funding, safety net funding, applicant defined grants, which we still do have currently for the remainder of this year, possibly into the future, but we're going through a whole strategic refresh, and have just recently, as of January, launched our new purpose plan. So I'll kind of segue into that, but this is to kind of give you a sense of the historical funding areas that we have worked in. All of this is changing as we move forward. I'll share our purpose statement. We refer to our strategic planning as purpose alignment, because we wanted to really go to a deeper level of what is the purpose of our organization, as we looked at our 15 years in grant making and said, what is our true purpose? We came up with, every day we work to support and build inclusive, powerful, and healthy communities characterized by racial equity and economically just systems. And so really, as part of this, we realized that health equity was our goal, and that closing the gap in terms of health disparities amongst race, ethnicity, language, gender was really our goal. And 2 of the areas that we saw as those key kind of drivers, and 2 of the lenses that we really focused on, were racial equity and economic inclusion. And so those are kind of the overarching themes that we really see as our purpose. Now, from this, we refer to this as our placemat. This is kind of our whole strategy on one page. I know that's probably difficult for all of you to read. I should mention all this material is on our website. But we came through basically with 3 kind of focus areas of power, people, and place, and then kind of a platform area, realizing that part of our work as an organization really needs to be focused on kind of cross-cutting work around racial equity and economic inclusion, and really also narrative change around that, really making sure that there's a dialogue about these issues and these social contributors and influencers of health. Our place area is the area I'll talk about a little more deeply in a second. Power is really about helping to strengthen grassroots organizations, to continue support for participation in democracy, to also support community-driven efforts. It's been said often, but it's true, those who are closest to the problem are also closest to the solution. And so we really want community voice throughout this. People is where a lot of our historical work kind of still lies. We're supporting organizations a lot of that will be done through multi-year unrestricted funding. As Carla said, we did the same thing where we realized that we needed to give our organizations flexibility. We've done that through some of our grant making in the past, but really COVID forced us to do that across the board. And I think going forward, a lot of our work will continue to be that way. And people also include some of our policy work and some of our innovation work as well. Our focus on place includes digital equity. Advancing digital access, literacy, and equity is one of our place strategies. We see place kind of as that really social determinant, social influencer category, also realizing that the other main component of that is housing, both from the standpoint of making sure that people are housed in safe and affordable housing, but even more so to basically address the racial gap in terms of home ownership and in terms of economic inclusion and basically wealth building and wealth generation. We realize that housing is a key driver of that. So really looking at home ownership as a driver of economic independence, which we know leads to better health outcomes. And so in terms of the digital piece, that's access is part of it. We realize that digital access is kind of a super determinant of health. You can't, really manage health insurance or access benefits or get a job or do so many other things, including telehealth, without a base level of competency and understanding technology and digital competency, but also realizing that that's a huge that there's the issue of connectivity, but also just understanding. So with that, it's already been a part of our grant making. One of the projects that we're really proud of and excited to continue work in is our community health worker digital equity grant that we gave to KC Digital Drive to help develop a curriculum. Realizing that we've funded quite a bit of community health workers, and increasingly not only their work, but the work that they're doing with their clients is really focused around how to navigate a whole digital world of blood pressure cuffs and websites and online appointments and reminders on cell phones and things like that. So that's really something that we see as an area of opportunity going forward. We've also helped our FQHCs and other oral and behavioral health partners around telehealth as they've shifted, not only because of the pandemic, but also realizing that this is a great way to access specialists or to get access to health services at more remote or satellite locations. And then we've also provided other special initiatives funding for different projects. Years ago, quite a bit of this was technology driven around health IT. Thankfully, a lot of that has, all of our organizations now have are kind of veterans in that space as they've gone through, migrations and learning how to navigate that. But that was an area where we were an early funder, and along with, Reach and others to really make sure that transition took place. So I'd say, in terms of going forward, equity and innovation are present throughout our approach. We have new strategic work around equity-centered innovation for the community health ecosystem under our people place, where our people strategy. We've really wanted to look at how can we create innovative approaches to that basically improve value-based care, or to payment models and other pieces like that, to make sure that innovation is happening. So a lot of pilot projects that we could potentially fund. Also, part of that is, race, ethnicity, and language data is, although not inherently a technology issue, is something that we see in terms as a real opportunity in terms of databases and analysis and public data sets, to make sure that things are disaggregated so that we can understand where there are disparities and where there's inequity in the system. So we will continue our advocacy for that. As I mentioned, my role as the process innovation strategist for Health Forward, we're looking to be more innovative in terms of how we do things internally and how we manage projects, and but also partnering with other organizations to really bring innovation to all of our organizations that we fund and that we partner with. And so that's kind of an exciting aspect of that that I'll be working on. And then lastly is that all of our new RFPs and funding streams are under development. They will all fit within this new purpose area approach, but we haven't identified or released yet the actual RFPs and sort of opportunities with that. So I would say for all of you that are involved with nonprofit organizations that might be interested in this, stay in touch. We will by the end of this year, beginning of next year, have start to roll some of that out. But I also want to mention is that one of the things we realized through this is that there are we've traditionally always partnered with nonprofits. We also realized that some for us are non-traditional partners, which are some for-profit entities and other quasi-governmental or governmental entities that we need to increasingly work with, particularly around issues such as digital equity. So we're looking to partner more and help convene. So that's another area. So definitely open to as organizations see opportunities, particularly for this type of work like that John is doing to help coordinate and bring things forward in the community. I think we're definitely want to be a partner at the table for that type of work. And so with that, I will again direct everyone to our website, healthforward.org. All this information is available there, and we'll continue to update as our RFPs and other funding opportunities are released over the course of the next year and a half. And with that, I'll open it up to questions. Or McClain, is there anything I missed or?
Well, no, I just like to just add some additional color, particularly as it relates to our policy agenda. So Brad mentioned our platform strategies, which are really sort of the overarching and connective tissues that we see between our purpose areas. And also within that is work that we intend to support in the various municipalities within our service area around recognizing race and race equity in all policy. And so we have awarded a grant to KCMO to establish their Office of Race Equity. That race equity officer will be responsible for taking a retrospective look at laws on the books, as well as keeping the various departmental leads and city council members to task to ensuring that future policy is drafted through a race equity lens. The work will start with the city's budgeting process to ensure that those resources are allocated in a more equitable fashion. We've got a somewhat similar grant that we've awarded to UCS in Johnson County to support an assessment and then some educational awareness in the municipalities within Johnson County, both elected officials, appointed officials, and staff within the various city halls, and are looking to do similar work in Wyandotte County and some of the other cities within our service area. We've done a couple of other digital equity related grants to De La Salle to support the digital equity needs of their students during the pandemic. And they were also very much involved along with REACH in the Community Foundation's COVID Response and Recovery Fund, and funded that effort pretty significantly and provided some thought leadership with regard to the needs in digital equity during the pandemic and sort of how digital equity permeates into just all economic activity. And then we also awarded, I think it was $150,000 to, I'm sorry, I got a call on my cell phone that distracted me, to School Smart KC to help meet the digital equity needs of students in both charters and public schools during the pandemic. With specific regard to our policy agenda, like Brad said, digital equity sort of lives in two areas within our strategy, both people with regard to telehealth access, knowing that digital equity is all wrapped up therein, and then also squarely in our place purpose strategy. And our current policy agenda is sort of organized in the form of Health Forward recent past. We'll be reworking it this year to be structured to track our new platform and purpose areas. But like I said, digital equity is in there really in two spaces. Innovation is all throughout. The policy priorities that we have landed on really track just the strategies that we intend to advance. And so you'll see data disaggregation policy in there. We worked with a Missouri senator to introduce legislation that would require labs and just the entire medical ecosystem to provide disaggregated data so that we can really get to those inequities so that we can attack those head on. We are also working on some community health worker related legislation to ensure that those services are reimbursable under Medicaid. We maintain Medicaid expansion and access as our number one issue, and we're the primary funding organization for the Medicaid expansion campaign in Missouri, and work in close concert with REACH and other foundations in Kansas, hoping to get legislation passed to expand Medicaid in that state. We also track affordable housing legislation, low-income housing tax credits, as an example, is something that we pay very close attention to on both sides of the state line. And so our policy agenda is also on our website, just as the materials that Brad shared. But just know we have put our policy agenda together, not just with our own interests in mind. Same thing with regard to our platform and purpose area strategies. We really want the work that we do to be reflective of the needs and the wants of the community. And so in putting our policy agenda together, really reach deep into the sort of the knowledge banks of our partners and our grantees, to hear directly from them what it is that we could be doing and how we could be showing up when we took a similar approach and putting together our strategy, understanding that we are much better resourced than
We lost her, John.
Yeah, we did. She dropped off, unfortunately. That was really important information too. Very, very good to hear about the policy initiatives for Health Forward. Some of those are just really critical to the world that KC Digital Drive works in, certainly, and I think the rest of you as well. We've had quite a number of people join since we began, and I'd like to go around and get introductions, but I think in the interest of time, we probably ought to go ahead with our presentations, and then maybe at the end, if we get the chance to introduce people, we'll be able to do so. McClain's back with us. Did you want to kind of finish your thought there, McClain? Apologize for the trouble.
Well, let me tell you, I was talking this whole time, so I don't even know.
Okay.
I don't even know when I got cut off. I will just say, gosh, what was the last thing you all heard? Was I still talking about grant making, or had I moved into our policy agenda?
You moved into policy agenda.
Okay, great. All right.
You've gotten a ways into the policy agenda.
Okay. Yeah. Okay. I will just end with our policy agenda is online with all of our other materials, and we'll be spending some time this year sort of reframing our policy agenda to track our platform strategies and our new purpose areas, just to make it, crystal clear the connection between the policy priorities that we are tracking in both Jeff City and Topeka, and how they're advancing our larger work. And putting that together, we'll likely reach out to KC Digital Drive and some other organizations, because we like for our policy agenda to be reflective, not just of sort of what we think, but also what we're hearing from those, that are deeply involved in the work, doing it every day, and interacting with the people that we serve on a daily basis. So we took that approach in putting together our last policy agenda. We know that we're a much better resource than a lot of other organizations. We have the benefit of the ability to afford lobbyists. And so we want to use our policy agenda and our advocacy work as a tool just to advance community efforts. And I'll end there.
Oh, great. Well, thank you, McClain. That was very thorough, actually. We, as I was mentioning, we are really grateful for everybody joining with us today. I'm sorry if we are not able to get everybody introduced, but I think we want to go ahead and hear from Sean Brown of Kansas Health Foundation and what she has to share with us about their work. Thank you. Sean?
Good morning, everyone. And give me 1 second. Let me make sure that my screen is being shared.
It is. It looks good.
Perfect. All right. And let me go here. Okay, perfect. All right. Well, good morning, everyone. I'm Sean Brown, Program Officer with the Kansas Health Foundation. Delighted to be with you. In terms of the Kansas Health Foundation's purpose, KHF seeks to create strategies and develops partnerships to improve health for all Kansans by reducing health disparities and focusing on health equity. And so we envision a culture where every Kansan can make healthy choices where they live, work, and play. So I just want to thank you for the opportunity to talk a little bit about our Kansas Digital Equity and Inclusion Collaborative. When John reached out and asked me to be a part of the group to speak, I thought I will really be preaching to the choir. And what could I say that you don't already know? But I'm delighted to be here. I was able to attend the previous meeting and really enjoyed learning about some of the innovative efforts happening locally and nationally. So over the next few minutes, I'll just provide an overview of the collaboratives, a little bit about why we launched the initiative, the program design, the project goals, and some of our partner supports. So why focus on digital equity and inclusion? And particularly for us, we've been known for our policy and systems and environmental change work around health. And so we were new to the digital equity arena. And so for us, it was a matter of moving from the stages of awareness to will to action. And we've known that broadband adoption and literacy was an issue for some time, but as many of us began to operate completely in a virtual environment, it really rose to the level where we said we need to play a part in addressing this, and particularly for those communities that are experiencing some of the greatest needs. The other reason, as John mentioned earlier, is that broadband is essential infrastructure, and the lack of access is a significant equity issue that must be addressed because it really touches on every aspect of the social determinants of health. So whether that's economic stability, education, social support, civic agency, we know that it really is tied to health outcomes. So when we talk about achieving health equity, which we define as the highest level of health for all people, we know, again, as I mentioned, it requires addressing the health disparities related to social and economic factors. It requires addressing the social determinants of health. It also requires that we ask ourselves critical questions about the historical and structural decisions really that are contributing to conditions. For example, in some communities, there's a 20-year gap in terms of life expectancy, and particularly when we're thinking about redline communities. And so we have to ask ourselves, what can we do about it? And I believe that technology and data and innovation can help in terms of addressing some of those issues. So what determines health? I know you all are likely familiar with this graphic or one similar to it. We know that 20% of health can be attributed to healthcare. The other 20% is attributable to genetics. And then the social determinants and those social, environmental, and behavioral factors represent 60%. And so when we think about it, those indicators around social economic status are income, wealth, and education. And so now more than ever, broadband internet access has to be recognized as a social determinant of health. And really the disparities in access should be treated as a public health issue because again, it really impacts people where they live, work, and play. So how can we impact health disparities? For us, it's critical to move upstream and to really focus on the conditions that are impacting the community. For example, someone may have a heart attack. But we need to be asking ourselves, what are the community conditions that actually contributed to that? Maybe it was a high-fat diet, or there's not a place that's in the neighborhood for walking and exercise, or safety issues are a concern, or stress or a lack of finances that, or lack of access to routine care. We know that, there are amazing technologies when it comes to medical interventions and clinical care, such as virtual reality and robotics and artificial intelligence. And we're grateful for all of those benefits. But if we're going to make the greatest impact on health, we need to think about how these operate in tandem and really be thinking about it from a prevention standpoint with a 2-generation approach in mind. So for Kansas Health Foundation, as I mentioned, we are working to place equity at the heart of our work. And so one of the ways that we address racial equity and health disparities, one way that we're doing that this year is by focusing on communities with the greatest health disparities, particularly those in redline communities, looking at ways that we can support organizations led by and serving people of color, looking at ways that we can support organizations that are focused on equitable policy outcomes, and then focusing in on civic and community engagement with communities of color. So what is KHF's approach to not only this digital equity and inclusion effort, but as an organization as a whole? And I wanted to share this graphic with you because KHF is going through a strategic planning process. And so we are learning and unlearning together. Some of our team members are part of an equitable evaluation initiative, which created this graphic for us. And so it really kind of captures some of our journey. As you can see, we're on this winding road. And through this year, we have had new leadership, staff changes. And so we're in a season of transition. We're building relationships with communities, and we know that we're not the experts. We're looking at our work in very different ways from a macro level and really regarding systems change. So by the end of the year, we'll have more concrete details on what our strategic direction will look like. But while we are in this time of transition, this initiative fits under our family supports identified in our 2022 policy priorities. And so we seek to back policies and funding that strengthen access to childcare, supports in educational needs, remote learning, digital connectivity, and expanding economic opportunities for families. So how many of you went from this type of office environment where you worked with colleagues, collaborating on projects, to this scenario where you were still connected through Zoom? I know that was me during the pandemic on the early days, and I really felt like I was able to survive and do my work because we were equipped to be connected, socially through the internet. If there was a need for a doctor's appointment, many of us could have done that through a telehealth appointment. And so it really just became critical. We're living our lives online, banking, shopping, working, not necessarily in that order. Our pets may be even online, helping do our children's homework. And some of us even are tracking our times on our devices because we might feel it's too much. We're connected to our iPad, our iPhone, laptop, Twitter, TikTok, Snapchat, Instagram, YouTube, you name it. But we know that that is not the case in many regions across the state. Many Kansans are living in communities with inadequate broadband access, and they don't have access to digital devices, particularly low-income communities of color, rural and other areas of the state are having lower adoption rates. And the legend on this map might be a little bit difficult to see, but the details in this report prepared by the Kansas Health Institute called Variations in Internet Access Across Kansas shows you can see these areas in black where as many as 40% or more of residents are lacking adequate internet connection. Also, essentially more than, essentially children 0 to 18 were lacking internet access, 1 in 4, and also a quarter of non-elderly adults also lacked adequate internet access, potentially impacting their ability to work remotely. In Topeka, 25% of the residents lack the device and high-speed internet. And so we know that there are disparities in internet access in Kansas by race, that Kansas identifying as Black were 1.6 times more likely than whites to lack internet access. And those identifying as Hispanic were 1.4 times more likely than Hispanic white Kansas to lack internet access. So broadband adoption and digital access and literacy, as has been mentioned before, is a necessity in today's job market, with more than 8 in 10 middle skill jobs requiring digital skills. And we also know that almost 1 million tech jobs go unfilled in the US. So imagine what that could mean for our state if Kansas became known for its workforce having the necessary digital skills for employment and entrepreneurial opportunities. And so with these ideas in mind, we developed the Kansas Digital Equity and Inclusion Collaborative. As I mentioned earlier, we are not the experts in this work, but we view it as our job to support those organizations who have been working towards digital equity and inclusion. And so the National Digital Inclusion Alliance served as a sounding board in the early days of developing the concept, along with many other stakeholders that we contacted. And so NDIA offers practitioner support, policy awareness, and data and research to our funded partners. One of the practices that we also consider important, in addition to our focus on equity, is that of being a learning organization. So we engaged Harder & Company to really guide KHF and our funded partners in an equitable strategic learning approach for this initiative. And we also benefited from their thought leadership and partnership during the concept development. So having met with multiple stakeholders, we developed the RFP, and then we launched the initiative in August of 2021. And so these collaboratives are responsible for developing a framework unique to their local context to advocate for policy, services, and digital inclusion. And then we also want them to think about ways to educate community members about the disparities in terms of home usage. Think about ways to work with the business community in terms of creating that case for greater adoption. And then if there are any smart city technology initiatives to make sure that equity is being built into the planning process. And then lastly, to be tracking the source of federal funding that is going to be made available, ensuring that the consumers facing the greatest barriers are able to benefit. And we know a lot of funding will be coming down the pike. And we just wanted to make sure that they were also equipped to take advantage of that. So in terms of our funding partners, the city of Topeka is planning to utilize community digital navigators and technical navigator positions to help secure devices and point them to affordable internet services and programs that they qualify for. So also, these navigators will collect, coordinate, and share community-based resources to provide literacy tech training and basic technical support. And they will be working in 31 low to moderate income neighborhoods. Groundwork Northeast Revitalization Group is launching a hotspot library and a digital task force. And they are being supported by a digital equity coordinator to really create a channel for grassroots advocacy and co-learning around digital inclusion for those residents in Wyandotte County. The University of Kansas Center for Research is working with women transitioning from incarceration in Northeast Kansas and really supporting their reintegration into society in terms of employment, healthcare, and just being able to meaningfully participate once they are out of incarceration. And so supporting technology access and skills among women in this transition is really critical, we believe, because the vast majority of women coming out of this incarceration are low income or from racial and ethnic minority groups. And about 60% of women in prison have at least one child under the age of 18, which makes it really essential for them to be equipped with this knowledge and skills to be able to support their children. And then last but not least, KC Digital Drive is building a collaborative network of community benefit organizations and other stakeholders to develop projects and programs and advocacy on behalf of low-income, minority, and underserved residents in Wyandotte and Johnson County. And some of the solutions being considered are, ways that families could be provided training for children and parents at the same time, but maybe in different or different times of a program. And, maybe children are learning to code while adults are learning about workforce development, for example. One solution for the lack of adoption and digital literacy may be involving organizations in the network and making sure that they're having digital inclusion as part of their program. So very excited about the work that these organizations are doing. We all rely on being connected. And we know that when we remove those barriers to health, like poverty, discrimination, racism, and we promote improved access to healthcare and good jobs, that's when all people can attain their highest levels of health. So we believe that digital literacy can really play a critical role in supporting communities of opportunity. So we're thankful for the work that these collaboratives are doing, and know it's going to be critical in terms of closing the wealth gap, social gaps, and really make a difference for the health of all Kansans. And here's my contact information if you have any questions. I'm happy to connect offline as well. And thank you so much.
Thank you, Sean. That's really great. One of the things that I find very interesting and heartening actually across the three foundations is that all of them have a hand or a foot in both urban and rural constituencies. And particularly in technology, there's often been a sort of divide between urban and rural. And I think lately we've come to see that many of the needs are very similar. While each do have unique needs and they do need to be understood and dealt with, there's more commonality than people thought before. And I think that COVID really exacerbated that situation, but also brought it to light so that we could see that there is so much commonality. I was wondering if each of the foundations might just say a few words about that, kind of having a foot in both camps, both urban and rural. Unfortunately, Carla had to jump off for another meeting. She's posted her email address in the chat for anybody who would like to just reference this meeting and follow up with her on things specific to the Reach Foundation. But for our other presenters, I'll again kick back this question about urban versus rural. Is that really a real dichotomy, or is it something to leverage? Sean?
Yeah, I think in a certain respect, it's something to leverage. Like you said, there are similarities between both areas. We know from a state perspective, I think there's, of course, coverage and emphasis in terms of those rural areas that don't have access to broadband or digital devices. I think in terms of the urban areas, there may be urban areas that have access in general, but there can be those pockets of neighborhoods that are particularly lacking a sufficient coverage. And so, our thinking is ways to think about those areas and really letting our funded partners be the driver in terms of what that looks like. So those are my thoughts.
Thank you. Brad?
Yeah, I would say that, we view it as a real asset. I think, at times it's challenging because they are very, some of the needs are very different, but we've really taken a kind of asset-based approach. One of the things that we've used as an example is there's a great video out there about curb cuts where, many years ago, if, walking down the street, you had, curbs did not, lower to the crosswalk. And that was really a byproduct for the most part because of the Americans with Disabilities Act. But it actually has benefit, when you think about those curbs of all the people that it benefits, it benefits people that have luggage, it benefits people with strollers, it benefits cyclists who are walking their bike across or riding. So we kind of view our work with both urban and rural populations as a benefit of where can we find things that are universally helpful, and where can we leverage things that maybe have or innovations that have worked in certain locations or with certain populations that may be transferable to others. At the same time, we recognize that they have unique needs and unique challenges, and that's why we've really we have board members from Allen County, we have board members from Lafayette County. We really do see them as distinct, so we don't want to use one size fits all approaches, but it's really been, we try to view it as an asset, and I would say that it can be challenging, and but at the same time, I think it gives us multiple perspectives on things. So
just a personal thought question here: how did Allen County fall into your purview?
So I believe I'm not an expert on hospital facilities, but I believe the hospital or a outpatient clinic that was located in Allen County was originally owned by Health Midwest. And so I know that the hospital now is managed by St. Luke's, not HCA, but there's it really, and a lot of it came down to, actually we were, it was initially one foundation that was envisioned, and then through that, the Reach and Health Forward have the exact same service area, but we are mandated to have our physical office in Kansas and Missouri, and Reach is mandated to have theirs in Kansas. And that was sort of two secretaries of state and two governors kind of arguing about making sure that their state each got a fair share of the proceeds. So it's just sort of a historical relic of that. But we also realize that downtown Jackson County versus eastern Jackson County are two entirely different places, and even within Wyandotte County you have a vast difference. So I think even within the KC the sort of KC metro area, and that was actually part of our we used to be the Healthcare Foundation of Greater Kansas City, and the joke was, well, we don't actually do healthcare, we do more than that, and we're not actually just Kansas City, and there's no, so Health Forward was a much more aspirational term that was actually also more accurate. So
well, that's a bit of history. Thank you very much. Appreciate that. Very useful. Ron Whiting, why don't you go ahead and ask your question, if you would, please?
Yeah, I was just, a lot of our work, we identify challenges that really are not solvable by any one player. And there's a lot of alignment among the funders on some of the issues we've talked about and other things, especially increasingly health equity. And so I'm curious, I've heard some ways in which the funders collaborate. I know there's a behavioral health funders group, but I'm just curious moving forward, both how the funders talk to each other about not fragmenting efforts, and maybe tied to that question is ways in which folks can approach the foundations in a collaborative manner, where we think maybe there'd be some benefit from multiple funders.
I might pitch that to McClain to start. McClain, does that suit your needs or your abilities?
I think McClain had to hop off, actually, but unless
you want to pick that up, Brad?
Well, I would say that's always a challenge. It's we all have our boards of directors and our separate strategic plans and our separate timing, and so it's something that I think we all view as a opportunity to do better. And I think we our funding of the Health Equity Learning and Action Network was a realization that things had to happen at the system level. I would say just anytime you contact any of us, bringing forward that you realize that this is going to be a larger project, or that this is something that you may want to be, you know, you needs to be collaborative. I'd say the Kansas funders meet together regularly through Kansas Grant Makers in Health. We sit at a lot of the same tables in terms of, like there is a behavioral health funders group. But I think it's definitely an area where I know we, at least from the Health Forward perspective, know that it's something we need to get better at, and also something we've increasingly heard from our grantees and partners that, oh, well, if you're not doing this, like, have you told your other partners about this? And so, and we have, but it is a thing that we realize that, I think there's more collective work is probably in the future. So.
Okay. Sean?
Yeah, I would say, for us, as I mentioned, we're kind of in the strategic planning process. And so, we'll be more defining specifics in terms of our direction later in the year. I agree with Bradford. Anytime there's an opportunity to think about ways that we can collaborate, that's always great to do. As I mentioned, we're more of the newcomer in this space, and and kind of where this current initiative fits in. So, but the idea of collaboration, I think, is an important one from the perspective of, we ask that for example, with these collaboratives, we're asking them to bring together various partners and think about a plan. So I appreciate that question.
Yeah. Yes, it's interesting too, and I think that the grantees can also play a role within that. I find that within what we do at KC Digital Drive, that we can often leverage funding from one place and expand upon it in another. For instance, it's really clear to me that work that we did early on for the Reach Foundation and looked at how is it that you can get a greater penetration of technology in safety nets and in behavioral health, led to the idea that we needed to be very, very much more attentive to social drivers of health, as well as to really being with the people themselves, getting out into the community rather than just building it and believing that people will come from that. And that leveraged very directly what the role of a community health worker might do, which is work that we're doing currently with the Health Forward Foundation. And likewise, how is it that we connect people directly in the advocacy work that we're doing with the Kansas Health Foundation? So we do ourselves play a role in making sure we get leverage from the things that the foundations are doing. And if we can play any role in collaboration, we certainly want to continue that. Derek, you had your hand up.
Yeah, I'm new to the area of funding. I worked in for-profit before this. So the question is about the level of development or the stage of development projects are when it's right to start asking for grants. Because what I'm working on is a software project and it's in line with something that would have a grant. It's developing a tool that aims to be extremely valuable and then giving it away for free, releasing the source code for free so that anyone in the world, no matter their situation, can use this powerful tool. But, like building a house, you don't put people in it until it's actually an adequate shelter. Software is the same way. If it's not a real great tool, the value is kind of lower. So where does funding come in during this early stage development? And when is it too early? When is it time to strike on funding?
Brad?
Yeah, I would say, we're probably, most in terms of anything that's software or technology related, it's probably a little further down the road. I think we have not, I think we'll continue to evolve. We have looked at things such as program related investments and mission related investing, actually using some of our capital to invest in things, but that's still a process that has to work through our, all of our sort of governance structures to make sure that we're, mindful of those things. And that's something that's under development. So we're not really fully ready to do those types of investments. yet. I think in terms of, we still are, really bound by our 6 county sort of service area. And so I think with a lot of things, it's sort of like being able to show what the impact is going to be to our region. If it has a broader impact or beyond that, then that's still fine. But I think like with that example, we would really want to understand kind of what is the impact regionally first and foremost. So I think anytime you are at a phase where you can tangibly explain how this is going to impact locally. And I think also it's, I think with a lot of things that, partnership is important. So for instance, with, working with John and Aaron, and, they had the partnerships established with Kansas City Care Clinic and Mark and UMKC. So it was a very tangible kind of proposal of, hey, we already have these players in place. This is what we want to do. And this is how it's going to, and where it will kind of go from there. So I'd say, there's no kind of true right or wrong time, but I think being able to say, here's how, other partners locally, specifically will be able to use this, and here's the path, and here's how they've, demonstrated a desire for it or a willingness to move forward with it. Those are always the questions we ask, I would say.
Sean, do you have a few thoughts?
Just add that for us, I think it would be, again, as I mentioned, letting the community or place-based efforts be the driver in that decision-making kind of, as was mentioned, like what are the ramifications? What is this technology? How will it be used? How is it dealing with upstream issues? What's the community buy-in? So those would be kind of questions that we would be thinking about.
Okay. Also, Derek, something that I think that might be useful to you is just further discussions with Casey Digital Drive, because what we might be able to do is find alignment with the project where it makes a lot of sense to have a commercial partner at the table to be able to provide something that might not otherwise be able to be provided.
Yeah, John, Derek, and I have already set up a time to meet. I was intrigued by what he said. So yeah, we're getting together in a couple of weeks. So.
Yeah, because we view collaboration as a situation where any number of kinds of people could be around the table to promote some sort of valuable project. So I'll encourage you to keep up with Jim on that. Thanks. Teresa, you have your hand raised.
Great. Yeah, thank you. Yeah, kind of harking back to the days at Blue KC, which has, as you know, 33 counties in the bi-state area. As part of like the corporate giving through community engagement, I know we sat at the table in kind of the greater Kansas City funders in health. So on a periodic basis, we would meet and actually talk about potential projects that we could work together on and actually form a consortium to fund into. So whether it was a pilot project or taking something to scale. So that might be another thought for the funders here, and including, health plans, but also large self-funded companies were at the table as well with their corporate giving dollars. So just wanted to throw that out.
Thank you, Teresa. Do the respective foundations find themselves aligning with the kinds of partners that Teresa just mentioned, Sean?
In terms of collaboration, we do feel that's important. Again, as kind of a newcomer to the space, I know, we've had some conversations in terms of collaborations with our Kansas grant makers in health, but we've not delved into that very much as it relates to digital equity. And
okay. Brad?
Yeah, I think, again, we sit at a lot of tables, and particularly our leadership. And, I would say, the other thing with, I know Carla is on a national organization around rural health. Our CEO, Kiana Thomason, was recently appointed to a rural health kind of task force. I think and I mentioned that partly with the question of the divide between urban versus rural that you had asked about earlier, John. But I also think that there are things that quite a bit of partnership we do nationally as well, more around making sure that we're kind of pulling the best from other communities in terms of ideas and practices and approaches. But yeah, we definitely try to coordinate as much locally as possible. I think all of us are trying to seek as many good ideas and opportunities as we can. And I would say that often one of the limiting factors is that we all are on slightly different timetables in terms of our strategic refreshes. We're all have slightly different service areas, so sometimes it's hard to find something that fits everyone's kind of framework. But I think increasingly it's something that we are looking to do even more of. And I think that the Health Equity Learning and Action Network is an example of that, where we're really trying to drive community-wide change. So.
Okay, great. Any other questions from the group? Well, this has really been tremendous. I'm very grateful to our presenters today because of the support that they've given to KC Digital Drive, and that's ongoing as we speak, but also for the role that they certainly play in the community and how powerful you've been so far and meaningful to many, many organizations. So we're grateful for your time to be with us and to share a little bit about your directions and philosophies and particularly thoughts about digital equity and so on. So thank you very much for that. We have a couple of minutes left. I might just go ahead and see if we could get some of the people who joined us to introduce themselves. Marlene, would you be able to say hello?
Certainly. Good morning. I'm Marlene Nagel. I'm Mark's Community Development Director, and I was pleased to be on the call today. Thank you.
Thank you. Jeff Blackwood.
Oh, hi, Jeff Blackwood, founder of New Frontier Mobile Diagnostics. Happy to be on the call with you guys today. Thanks for being on.
Great, thanks, Jeff. Amy?
Hi, this is Amy Roberts from the Kansas City, Missouri Health Department. I'm the program manager for the Lead Poisoning Prevention Healthy Homes program, and the presentations were awesome today.
Thanks, Amy. Let me see, who else do we have here that we have missed? Sorry, I'm just scrolling here. Anybody else who we missed? If you would go ahead and introduce yourself. Lucia, are you still with us? I guess not. Okay, well, if we don't have any others, let's.
Hey, John.
Yes.
Sorry, Dennis Ridenauer here.
Yes.
I just wanted to briefly mention we've got an event next week that is probably of relevance to some people on the call, but the Nexus Informatics Conference, it's kind of all things data, but we also have a session that's focused on application and like Anurag is participating in that. Might be of interest, really all things data, medical, human, animal, all sorts of different stuff, but if people are interested, it's usually a good event. It's gonna be out at Kansas City University. So.
That's great, Dennis. Thank you. I apologize for neglecting that. I have had the opportunity to attend the Informatics Conference several times and have always found it very, very informative, even though, by definition, I'm not an informatician, but just to understand the work that people are doing in the community and the applications that it might have in a broader sense have been tremendously useful. So I definitely support your efforts there and hope that some of our team will be able to take advantage of that. Any other thoughts or announcements from the team? Well, great. Again, our thanks to our foundation supporters and presenters, and look forward to seeing everybody next time around. One of the things that we'll actually be looking at is the Community Health Worker Project supported by Health Forward Foundation in our next month's meeting. I'll have an ability to give kind of a wrap-up report on that to everyone, and look forward to seeing you all.
Thank you.
Thanks. Bye now.
Thank you.
Thanks, John.
Thanks a lot.